I got a call from New Zealand, from institute side, that she has met with a severe accident. It was 12 o'clock in the afternoon, 12:30 around. She has met with an accident, and it was very shocking. And we were told that the accident is so severe. I mean, I had no words how to react and how to express my feelings.
इनका ग्रुप था तो इन्होंने रोड ट्रिप एक प्लान किया था. अनफॉर्चुनेटली ये चीज़ें हुई वहाँ पे.
She was not able to talk, she was not able to walk. I mean, she is partially conscious, I would say, not completely conscious. She was partially conscious.
काफ़ी लोगों से हमने पूछा तो बहुत सारे सजेशंस मिले टेक्नोलॉजी पॉइंट ऑफ व्यू से, ट्रीटमेंट पॉइंट ऑफ व्यू से और इम्पैक्टेड ट्रीटमेंट पॉइंट ऑफ व्यू से मैक्स को बेस्ट बताया गया, तो हमने इसको सेलेक्ट किया.
So I came into contact with Dr. Tarun, Dr. Reddy.
Akia Chaturvedi is a 21-year-old lady, unfortunate to have a road traffic accident. In this accident, she had a very severe brain injury and a spinal injury. She was immediately rushed to an emergency care in New Zealand, where she was taken care of very appropriately. She was put on a ventilator, was continued and kept what we call in situ, which means it was kept in the neck. She was then transferred to India, and this was done after a lot of deliberation, making sure that she could be safe during travel. And there were a lot of consultations with us during this period, and we ensured that she could travel back all the way from New Zealand to India safely.
So when I was asked, that there's a girl in New Zealand who had a severe head injury, I was really surprised that, people are still unaware of neuro rehab facilities. So I promptly told them that, we have one of the best facilities at Max Hospital Saket, which is run by Max at Home setup. They shared their discharge summaries and reports with Dr. Rachika Reddy, who was the primary consultant for the patient. And then, patient was flown by an air ambulance to Max Hospital Saket.
After discussion, I got a confidence that this can be taken care. And they almost mentioned about the days, or in how many days she is going to be on her legs.
The first was with regard to her seizures. As a result of the head injury, there was a high risk of having seizures. She was on some anti-epileptics, but we felt that some of these anti-epileptics that were going on, which were very appropriate to control seizures, were unfortunately having some adverse effects, and we had to change that. We changed that, and these adverse effects disappeared completely.
मैक्स में एडमिट होने के डे 1 पे ये ना तो चल पाती थी ना बोल पाती थी, ये कोई भी चीज़ इनके पास नहीं थी. एंड 3rd to 4th डे शी कैन एबल टू टॉक, शी कैन एबल टू वॉक, एंड बहुत सारी चीज़ें. ऑलमोस्ट हम ये कह सकते हैं कि डे 4 में ही 60 to 70% रिकवरी इनकी हो चुकी थी.
Along with that, there are some modalities which we started on cognitive and behavior issues. So we started with cognitive rehabilitation. So these kind of therapies were actually started for the patients, and then gradually now patient is actually able to walk under supervision.
At the end of a few days, she was discharged from hospital. She was taking by mouth. She was vocalizing. She could speak to her parents. She was ambulant with some support, and the parents were so happy that they decided that they'd stay back in Delhi. Huge amount of this credit goes to Dr. Tarun Lala and his team, which is a neuro rehab team, who performed a marvelous job to get her back on her feet. And not only are we overjoyed, but the patient and the family too are remarkably happy about the situation.
And then Dr. Tarun and the entire team, I want to thank each one of them, whether it's Dr. Anuj, Dr. Anil, Dr. Chawla, Dr. Tarun, Megha, and hats off to their dedication.